All right, we're about to dive into a pretty intense medical crisis. Imagine this. A routine surgery suddenly turns into an absolute fight for life. It's a story that reveals some incredible ingenuity when, the perfect cure is just completely out of reach.
So let's set the scene. We're starting in the operating room. On the surface, everything looks totally normal, a standard procedure. And for a while, everything is going exactly as planned.
Our patient is a 14-year-old boy. He's in for a pretty common surgery to correct a 33-degree curve in his spine. He's stable, the team's all set, and the procedure gets underway.
But then, about an hour and a half in, things start to change. The monitors, the machines keeping track of his vitals, they start telling a very, very different story. The patient's body is sounding the alarm that something is going terribly wrong.
And this is that critical moment. This is when a standard everyday procedure flips and becomes a high-stakes, life-or-death emergency. So, the very first warning sign is a spike in his exhaled carbon dioxide. The team sees it, they try to correct it. They hyperventilate him, change out the CO2 absorbent, but the number just keeps on climbing. His CO2 level peaked at 88 millimeters of mercury. Now, to give you some perspective, a normal level is somewhere around 35 to 45. So we're talking more than double. His body is just an absolute overdrive.
And then his core temperature starts to skyrocket. It reaches this incredibly dangerous high of 41.8 degrees Celsius. That's almost 107 degrees Fahrenheit. I mean, his body is literally burning up from the inside out.
At the exact same time, his heart is just racing out of control, hitting 180 beats per minute as his entire system spirals deeper and deeper into this hypermetabolic state.
And right here, you can actually see the crisis unfolding on the real chart from the case report. Just look at those lines for temperature, CO2, and heart rate. They're all just soaring completely out of control. It is a perfect visual of pure chaos. So what in the world was happening to this poor kid? Well, the team pretty quickly suspected that a rare, deadly genetic disorder was being triggered by the anesthesia itself. They figured he was experiencing something called malignant hyperthermia, or MH for short. It's a pharmacogenetic disorder, which is a fancy way of saying a person's specific genes cause this catastrophic reaction to really common anesthetic drugs. Okay, think of it like this. An abnormal gene creates a faulty switch in the muscles. When that switch is flipped by the anesthetic, it unleashes this uncontrolled flood of calcium. It's like slamming the accelerator to the floor on every single muscle in the body, forcing them to lock up and burn through energy at a totally explosive, unsustainable rate.
So, the diagnosis was almost certain. But just as the team figured out what they were up against, they got hit with a monumental challenge, something that changed the entire game.
They used a clinical grading scale, and they scored this event a 68. Just so you know, any score over 50 is considered almost certain for an MH event. So yeah, there's basically no doubt what they were dealing with. And here is the crucial point, the real kicker. In this critical, life-threatening moment, the one drug that's specifically designed to stop this reaction, the antidote, dantrolene, it wasn't available. They didn't have it in the hospital. This slide just lays it out perfectly. The standard playbook for MH has dantrolene right at the center of it. So without it, the team had to fall back and rely completely on the fundamentals, just aggressively fighting the symptoms to try and keep the patient alive. They took immediate, decisive action. They cut off the anesthetic gas, changed the entire breathing circuit, and then launched a full-on assault against the hyperthermia, covering the patient in ice packs, infusing cold fluids right into his veins, anything to manually bring that raging core temperature back down. And here's the amazing part. Against all odds, the team's rapid, relentless supportive care, it actually worked. The fire inside his body began to die down, and the patient's condition started to stabilize.
In fact, the case report says he was taken off the ventilator the very next day once his blood pressure and CO2 levels were back to normal. That is just an incredible testament to the team's skill managing a crisis without their single most powerful tool.
But this patient's survival, it does more than just tell one amazing story. It shines a really bright light on the realities of managing malignant hyperthermia in places where resources can be scarce, like in India, which is where this case actually took place.
The thing is, many hospitals in India just don't have ready access to dantrolene.
And on top of that, the really specialized genetic and muscle tests you need to definitively diagnose someone's susceptibility, well, they're either not available or they're way too expensive. And what that means is that clinicians have to rely almost entirely on their own vigilance and clinical skill.
And honestly, this is the ultimate takeaway from this whole incredible case. The authors themselves say that even without the ideal tools, lives can be saved. The crucial thing is just meticulous monitoring of basic vitals like carbon dioxide and temperature, and then acting fast.
This story really makes you stop and ask an important question, right? In medicine, success isn't always about having some miracle drug on hand. Sometimes it's about the relentless, skillful application of fundamental care under the most extreme pressure you can possibly imagine.